Hi, today we'll take 7 minutes to understand your kidneys. Two bean-shaped, fist-sized organs just below the rib cage on either side of your spine. They are the body's master chemists, working 24/7 to keep you healthy. Every day, your kidneys filter roughly 120 to 150 quarts of blood. From that, they make about 1 to 2 quarts of urine, removing waste and excess fluid. First, waste filtration. They remove toxins like urea and creatinine produced by metabolism and food. That keeps waste from building up in your blood. Second, fluid and electrolyte balance. Kidneys precisely regulate sodium, potassium, acid, and water. This keeps your cells and organs functioning properly. Third, they help regulate blood pressure by producing renin. Fourth, they release erythropoietin, which stimulates red blood cell production. Fifth, kidneys activate vitamin D so calcium is absorbed for strong bones. Sixth, they maintain acid-base balance to keep blood pH stable. When kidneys fail, waste accumulates, a life-threatening condition called uremia. Advanced failure may require dialysis or a transplant to survive. So, filtration, fluid balance, blood pressure control, red blood cell production, bone health, and pH balance. Your kidneys do all of this every day. Next, the major threats that silently damage kidneys and what to watch for. Because early detection saves function, let's begin. Kidney disease often progresses quietly. It's a silent killer until late stages. Here are the primary threats. 1. Diabetes. High blood sugar over time scars millions of tiny filters called nephrons, the leading global cause of kidney failure. Protection. Meticulous blood sugar control is paramount to prevent diabetic nephropathy. 2. High blood pressure forces vessels to work harder and damages kidney blood vessels. Control BP toward a target like less than 130/80ths. 3. Chronic glomerulonephritis. Inflammation of the glomeruli from infections or autoimmune disease can progressively impair filtering. 4. Polycystic kidney disease, PKD, a genetic disorder where many cysts replace healthy tissue and disrupt function. 5. Acute kidney injury, sudden damage over hours or days from severe dehydration, blood loss, certain meds, blockages, or sepsis. 6. Nephrotoxins, frequent NSAIDs, some antibiotics, contrast dye, illegal drugs, heavy metals, and certain herbal remedies can injure kidneys. 7. Chronic dehydration increases kidney stone risk and UTIs. Stones can block flow, cause infection, and damage kidneys. 9. Smoking damages vessels and raises kidney cancer and BP risk. 10. Obesity increases risk of diabetes and hypertension and directly increases kidney workload. Classic early sign, nocturia, needing to urinate at night because damaged kidneys can't concentrate urine or because glucose pulls water out. Also test for proteinuria. Albumin in urine is an early warning. Edema, swelling in legs and around the eyes, can indicate poor fluid removal. High blood pressure can be both a cause and a sign of kidney disease. Acute kidney injury may present quickly with decreased urine output, confusion, or rapid fluid buildup. Urgent medical care is needed. Summary. Diabetes and high blood pressure are the main drivers. Toxins, genetics, infections, and dehydration also matter. Early testing saves function. If you're at risk, ask your doctor for eGFR and urine ACR tests. These are the best screening tests for kidney health. Now we'll cover proactive steps to protect kidneys. Practical, daily actions that matter. 1. Hydrate sensibly. Drink water throughout the day. About 2 liters or 8 glasses for most healthy adults. Aim for pale yellow urine. 2. Lower sodium. Avoid processed foods, canned soups, and fast food. Cook with herbs and spices instead. 3. Moderate protein. Too much, especially from red meat, can increase kidney workload. Balance animal and plant proteins. 4. Watch potassium and phosphorus if you have CKD. Early stages may tolerate whole foods, but later stages need strict limits guided by a dietitian. 5. Control blood sugar and blood pressure. This is the most effective way to prevent kidney damage. 6. Use medications wisely. Avoid chronic high-dose NSAIDs. Always discuss OTC and prescription drugs with your provider. 7. Don't smoke. Exercise regularly and maintain a healthy weight to lower risks of diabetes and hypertension. 8. If at risk, diabetes, high BP, obesity, family history. Request serum creatinine, eGFR, and urine ACR testing regularly. Foods that can reduce kidney inflammation include fatty fish, salmon, mackerel, sardines. For omega-3s, berries, blueberries, strawberries rich in antioxidants. Olive oil, healthy anti-inflammatory fat. Dark leafy greens, high in vitamins. Caution in advanced CKD for potassium. Turmeric, curcumin, garlic, red bell peppers, and cabbage. Anti-inflammatory, low potassium options. Avoid chronic NSAIDs, smoking, high-sugar diets, high-sodium processed foods, extreme cleanses, unproven herbal supplements, and holding urine frequently. The myth: special cleanses or detoxes. Kidneys are self-cleaning. Extreme cleanses can cause dehydration and dangerous electrolyte imbalances. Kidneys don't just filter, they reabsorb water, electrolytes, glucose, and amino acids. Precision recycling essential for health. Diabetic nephropathy. Chronically high glucose scars the glomeruli, creating a leaky sieve that lets protein through and reduces filtering efficiency over time. Nocturia happens because kidneys lose concentrating ability and because fluid pooled in legs is reabsorbed at night. Proteinuria and edema are other early signs. Some propose an intensive support protocol to address metabolic drivers, but medical supervision is essential. Always consult your doctor before major changes. Option: a ketogenic, very low-carb approach can lower blood sugar and insulin. But in CKD advanced stages, protein and potassium must be carefully controlled. Medical supervision required. Intermittent fasting can improve insulin sensitivity and help weight management. Again, must be individualized for people with diabetes or kidney disease. Increase plant phytonutrients. Flavonoids, sulforaphane, and lycopene help reduce oxidative stress and inflammation. Supplements like benfotiamine and alpha-lipoic acid may protect vascular tissues in diabetes. Discuss dosing and safety with your clinician. Curcumin from turmeric may reduce inflammation. It's supportive, but not a substitute for medical care. Important: stages of kidney disease change recommendations dramatically. What helps early may harm later. Always work with a doctor and a renal dietitian. Checklist: hydrate, get eGFR and ACR if at risk. Control blood sugar and BP, avoid nephrotoxins, eat whole foods, exercise, and quit smoking. Be proactive. Partner with your doctor. Thanks for watching.